So what are the warning signs or red flags if you already have a midwife or a care provider and you now looked at this Yolande Maritz case, or you're not really sure, maybe you have a gut feel? What are red flags to look out for? So because of this being such a high profile case and a lot of the spotlight on midwives, I want to include this section here to help you understand the red flags when you have a birth attendant. You can apply this if you have a doctor or a gynae, but this is specifically for like a home birth midwife, when to take action. So be wary of midwives or healthcare practitioners that dismiss your concerns or your partner's concerns. That is an immediate red flag. If you have any worry or concern and they make you feel silly for just thinking or asking about it, they should always just have a look, even if it's nothing. Hear you out, investigate, do the proper thing and look into it. And then they can say, oh, you know what, it's okay. It is just a ligament pain or something like that. But they have to listen to your concerns, because you are the only one that knows 100% what you are feeling. If the baby is moving, if you are having any pain, it's just objective to them. So you need to make sure that their response you are happy with. If you're not, find a second opinion or transfer care to someone who listens to you. If you're being dismissed, it's a red flag, because why, if they don't listen to you in pregnancy, why are they going to listen to you when it's crucial during the birth or when the baby is born? Anyone who discourages you to have a hospital backup, big red flag. If you have a home birth, you should always have hospital backup. If anyone says, no, you don't need it, immediately move on. This is a bad idea. They need to have adequate emergency equipment. Walking in with just a pair of gloves and being ready for this birth is not adequate. They need to be able to resuscitate this baby and have the necessary equipment to help you in case of severe bleeding or the baby needing extra help until an ambulance arrives or until they can get them to proper care. If anyone seems resistant to transferring you, red flag. And this is what happened in more than one case with this Yolande Maritz case, where parents wanted to transfer and she dismissed them and she said it's not necessary, and they were uncomfortable, but they felt like they didn't have a choice in the matter. You always have a choice. No one can keep you at home. If your partner literally puts you in the car to take you to the hospital, you are allowed to do that. Now, there's always the other side that your baby might then be born in the car and then you've got no midwife with you. So it's not a black and white situation. But if you feel that it warrants a transfer because there's something that's really concerning you, or your gut feel is telling you something is not right and your healthcare provider dismisses it, you have every right to then take yourself there. But you should also know that if they are not with you and anything happens, then you're on your own. So there is also that risk. Calling an ambulance is your other option. They might sometimes take long. I can't tell you exactly what the right thing here is to do, because it depends on everybody's unique situation. Even if nothing is wrong and you've labored at home for a couple of hours and you are now saying, I don't actually want to do this, I want to go to hospital, they cannot stop you. You should be able to go. If anybody, midwife, gives you a home remedy, it's a big red flag. This is exactly what happened in this case with Yolande Maritz, where they were giving this rescue remedy. Water, tea, coffee, that is what you can have in a birthing center or at home from your midwife. Anything on top of that, you should rather have your own things. If you want to have something for rehydration or a little bit of juice, get your own things. It's not that you have to distrust everybody, but we've learned a lot from this, and this trust cost them big time. She lied. She blatantly lied. Luckily, she was scrapped from her role as a midwife. She's not allowed to practice anymore. But don't take anything that they give you as, oh, this is a home remedy that really works. If your gut feel tells you, whoa, double check this, don't ignore it. And then a qualified birth attendant should have the necessary paperwork. So what happened is that there was a big media coverage of this case, and she was suspended from her role as a midwife. And then she actually carried on doing scans at home for parents. She was not allowed to, because you need to be a practicing midwife if you want to be able to do these scans. There are also rules around that. And then the program in South Africa that covered this case, it's called Carte Blanche, they send in parents, it was undercover, to ask her if she can do a home birth for them while being suspended. And she offered those services. And when they walked into the room, her and her partner refused to talk to them, and they just packed up their things and they left. But that was not helping her already bad case at all, because she was practicing without a license. If you want to know that the person looking after you is valid, registered, if someone is unable to provide a certificate to say, or a license to say that I am currently now allowed to practice, then don't do it. Even if they have the registration to say, you see, here's my degree for nursing and midwifery, or certified midwife or something, just because they have that doesn't mean they're still currently allowed to practice. Because this Yolande, she will have that paper from when she qualified. But if she doesn't have the license, it means she's not allowed to practice. So if you want to make double sure, you are allowed to ask for these things to make sure you are in the hands of people who are valid and registered. Any fetal heart rate abnormalities while you are in labor, they're monitoring you. If there's any abnormality that they pick up, they should take some kind of action to rectify it. And if they can't rectify it, that warranties a transfer. You might not even know about it. If you are bleeding excessively after the baby is born, you need to be transferred. If you are bleeding before the baby is born, you definitely need to be in the hospital and not at home. If your water breaks and it's foul smelling, like it really has a bad odor, it is a sign of infection. You cannot have the baby at home. You have to be in the hospital or be in a care facility where you have more access to resources to help you in case of an emergency. If there's any problem with your health and you're not feeling well, or if the baby is born and the baby is in distress, they're unresponsive, it warranties that you need to get that baby transferred. It is possible that after a difficult labor or a difficult pushing, the baby can be a little bit tired and a little bit quiet or seem floppy, but they need to perk up. A baby that stays floppy and not responsive, that baby needs extra medical care. Whether that midwife says yes or no, you can make your own arrangements. In one of these cases with the Yolande Maritz case, one of the babies was not responsive and she dismissed the parents' concerns. I think it was a grandmother or the father who ended up calling the ambulance because they got worried. But that time delay getting that baby the proper care, we will never know for sure how much everything contributed, but that definitely contributed to the fact that the baby has severe health challenges. If the baby needed to be resuscitated, and I'm not saying just a little bit of oxygen, but resuscitated because his baby was so unresponsive, they definitely need to be seen by a doctor in hospital. If you hear the word cord prolapse at any point in time, you need to be in a hospital. A cord prolapse means that the baby's umbilical cord is coming out first through the vagina instead of the baby. The risk and the complications and the risk with a cord prolapse is severe. So you cannot have the baby at home. If that is the case, you need immediate transfer. The typical medical interventions that require transfer to a hospital or additional medical care would be the following, so you can take note of them. A long labor without any progress. So you've been in labor for hours and hours, and I'm not saying 24 hours, but you've gone from 2 centimeters to 6. I'm saying it's been hours, say 24 hours, you've been 2 centimeters, you're still 2 centimeters. They check you again in 4 hours, it's still 2. It's becoming so long, but very or no progress. That needs to be checked out in a facility. You cannot stay at home anymore. If you had a really prolonged time of pushing, generally an hour to 2 hours is what you can expect from a first-time mom to push. If you've been pushing, you're exhausted, it's been 2 hours and nothing is happening, even if a midwife says, no, everything is okay, and you feel it's not, you have the right to transfer care and say, but I would like to get to the hospital now, because there has been instances that I personally experienced where a mother was left at home for pushing for too long. I think this was 3 hours, if my memory doesn't fail me, which was really long. And she ended up in ICU. She nearly died from postpartum bleeding because her body in the uterus was so tired of pushing, it wouldn't contract after the baby was born. And she lost a significant amount of blood. We nearly lost this mother. So it is not small things when we say like these medical interventions. It is sometimes really life and death. It's not to scare you, but because you don't have the medical background, it is important to know certain things and to know when your gut feel tells you, make a decision. This is the time to listen to that gut feel, even if your healthcare professional might not say the same thing. Okay, then lastly, the key takeaways that I want you to have from this video. I'm going to link more of the carte blanche videos in the description below that you can watch the whole episode if you wanted to know more about it. But there are 3 things that I really want you to take away from this. The first one is you absolutely 100% have to know that you have a backup gynae. Not just the midwife telling you, oh, I've got a backup gynae. You need to see this gynae at least once or twice in your pregnancy, that you get to know them, have a relationship with them as well. In case you need an emergency C-section, then you know the doctor. And that you know that this midwife actually has someone that's willing to back her up. If a midwife doesn't have a gynae or a doctor that's willing to back her up, that is another red flag. Why does no one want to back her up? Backing up means if I trust you to do the home birth, but if there's a complication, I trust that you will let me know and I will step in and take over. A midwife needs to have a backup gynae, and you need to see that gynae at least once. Try more, at least once in your pregnancy. Secondly, you need to do the fetal scans. There's a fetal assessment scan at 12 weeks and there's another one at 20 weeks that look for any kind of abnormalities. In the Yolande Maritz case, one of these babies had issues that she did not pick up on the scan that she should have, but that she also probably wouldn't have because she was not a registered sonographer or a gynae that has the necessary expertise. Some of these moms were never seen by doctors or sonographers. They trusted this midwife and she missed important things. So even if you do trust your midwife and you're very happy with her, she's got a backup gynae. Do those scans. If you don't want to do a scan every time, those scans are done by professionals whose job it is to look for any abnormalities and tell you if it's a problem, if it makes you a high risk that you cannot have the baby at home, or if it prepares you for something that might become a problem, say a cleft palate that you at least can prepare for. The last thing anybody wants, which is what happened with one of these babies, is where a part of the internal organs was growing outside of the baby's body and she didn't pick it up. And when you have that baby at home, it's a massive emergency because that baby needs critical care and you don't have that in a home environment. And then lastly, listen to your gut. A lot of these moms, when I watch these videos, talked about not feeling comfortable, not feeling sure if they're doing the right thing or not, and then convincing themselves, but they trust this woman who betrayed their trust and who let them down. Gut feel is not just something that you make up. It is based on experience, your feelings, your trust. Listen to your gut feel, get a second opinion, get a scan, get an extra visit, whatever you need to do to either silence it or transfer care. But you've got every right to advocate for yourself and for your baby and your partner during pregnancy, during birth. And as much as this case cast a really big shadow on midwifery care in South Africa and perhaps elsewhere where this was also covered, it's also very important to have this coverage to educate more moms and more parents about the gaps in the medical care and things to look out for so that they don't fall victim to similar practices elsewhere where the rules might not be as strict. But at the very least, I hope this video gives you a little bit more of a guideline and a background and some context to know that you are making the right decisions, or to know and recognize the red flags so that you can act in time to safeguard yourself and your baby. If you found this video helpful and you think more parents need to see this, please like it, because then it will get shown to more parents out there and I can reach more people with the correct information. If you are still pregnant, I've got a lot of videos here that you might find interesting. There's a playlist here on birthing videos, C-section or vaginal birth that might actually help you. Thank you for watching.